Hi, I'm Dr. Stephen Stokes, and today I would like to explore with you how something as deceptively simple as laying on your back on the QuasarMD light therapy mat can activate an entire cascade of healing and regenerative mechanisms in your body. Mechanisms that will treat your body systemically, which means that whether you're suffering from low back pain, problems with sleep, digestive issues, or even mood disorders, this device has the potential to help you with all those different conditions. And it does it systemically, which is the way the body heals. The body doesn't heal specifically, it heals systemically. Now, the QuasarMD light therapy mat is based on what we know about light therapy. Now, light therapy has been around for a very long time. We know, for example, that when we're exposed to ultraviolet light, the human body will produce more vitamin D. So science already tells us that light has a strong effect on the human body, but recently we've discovered that different wavelengths have different effects. And one of the most powerful wavelengths is in the 600 nanometers, specifically around 660 nanometers of wavelength, which is red light. What this does is it affects the mitochondria in our cells. Now, the mitochondria are like the batteries of the cell, and when they're stimulated by red light, they increase production of something called ATP, adenosine triphosphatase. Now, this is an enzyme that basically creates energy. More ATP equals more energy, which means more energy for activities, healing, and regeneration. Cellular energy is the foundation of any regeneration protocol within the body, and red light therapy increases that. Now, this QuasarMD mat is a dual wavelength device. So in addition to red light therapy at 660 nanometers, we also have something called near infrared, and this is at 850 nanometers. Now, near infrared is more tricky, right? Because you can't see near infrared, but you can certainly feel it. It feels like a warmth. And what we found about near infrared light is that it goes deeper into the body. So it can access some of the organs, the joints, the muscles. And it does two primary things. It reduces inflammation, and it seems to have an effect on the chemistry that causes pain. So what a great combination of combining red light with near infrared light to treat the body. One of the things I'm most excited about with this device, though, is again this idea of systemic treatment. So in the past, if I was treating a patient or myself with red light therapy as an example, I would have to place the device on my neck for a treatment of, say, 15 to 20 minutes. Then I would have to place it on my stomach. Then I would do a treatment on my lower back or on my knee. A lot of people have multiple things wrong with them, and these treatments can really add up in time. However, if we lay on our back on the QuasarMD light therapy device, we're treating the spine. And remember, the central nervous system is contained within the spine. And all the nerves of the spine branch off and go to every tissue in the body, to the organs, to the muscles, even to the joints. So by treating the spine, we are generally treating the entire body. And in this way, I can do a 20-minute treatment on the mat, and I can affect everything in a systemic fashion, the way the body likes to heal, the way the body was designed. Now, I'm going to have my wife, Catherine, show us close up how this works. And then I'm going to circle back here and let you know how you can try this for yourself. Take your QuasarMD full light therapy mat and place it on a bed or a couch or on the floor. You need a workable surface. Unroll it and make sure you smooth out any wrinkles that you see on the mat. You have 5 different levels of intensity, and Kathy is setting it to the maximum intensity. Now, this is a dual wavelength device. You have both red LED and near infrared, and you can adjust the settings of each of those wavelengths in different forms of intensity as well to really fine-tune the type of treatment that you're looking for. It comes with protective eyewear, and you'll notice Kathy is wearing hers. Position yourself accordingly. Catherine is going to scoot down a little bit to make sure she's getting full coverage. And speaking of full coverage, this is ideally done with minimal clothing. There's an automatic timer with a minimum treatment of 10 minutes, recommended treatment being around the 20-minute mark, and 3 to 4 times a week for an effective dose. But you want to start off nice and slow and build up your tolerance to see how you do. We also have a 10 Hz flash mode and a 40 Hz strobe mode for advanced treatments. Make sure and remember that if you're light sensitive or have photosensitive epilepsy, this is not a treatment for you. Finally, make sure to clean the surface of the mat with a soft cloth between treatment sessions. For me, I really like the portability and the low profile. I can take it with me when I travel, and I can set it up in a wide variety of environments effortlessly. And I'm always thinking of new ways that I can incorporate this device into my busy life. So if you'd like to know more about QuasarMD Light Therapy, then you can click the link in the description of this video or take a picture of the QR code on the screen. I've been using this for 6 weeks now. I absolutely love it. It has replaced all my other light therapies. I have it set up in my spare room on the bed, and I use it for about 20 minutes every other day. Again, thank you for watching. If you have any questions, you can reach out directly to me. Please use the link in the description for a special offer, and I'll see you again soon. Bye-bye.